Welcome back to the channel. Today we're talking about atopic dermatitis, also known as eczema. It's one of the most common chronic skin conditions, especially in children, but it affects adults as well. This video is for you if you or someone you love struggles with persistent itchy skin, dry patches, or flares of rash that don't seem to go away. We'll walk through what atopic dermatitis is, how it's diagnosed, how to tell it apart from other conditions, and most importantly, how it can be managed and treated. Let's get started by understanding what atopic dermatitis really is. Atopic dermatitis is a chronic inflammatory skin condition that often starts in early childhood, though it can develop at any age. It's considered part of the atopic triad, which includes asthma, allergic rhinitis, and atopic dermatitis. Many people with this skin condition either have one of these other allergic conditions or a family history of them. The term atopic refers to the tendency to develop allergic hypersensitivity, while dermatitis simply means inflammation of the skin. So atopic dermatitis is essentially an allergic inflammatory skin condition. This condition involves a complex interplay between genetics, the immune system, the skin barrier, and environmental triggers. People with atopic dermatitis often have a mutation in the gene responsible for making filaggrin, a protein that helps maintain the skin's natural barrier. When this barrier is disrupted, the skin becomes more permeable, allowing moisture to escape and irritants, allergens, and microbes to get in more easily. This leads to inflammation and the typical symptoms associated with the condition. The hallmark symptom of atopic dermatitis is itchiness. The itch can be severe, persistent, and often leads to scratching that worsens the skin damage and inflammation, a cycle known as the itch-scratch cycle. In infants, atopic dermatitis often appears on the cheeks, scalp, and extensor surfaces like the outside of the arms and legs. In children and adults, it's more commonly affecting the flexural areas, the insides of the elbows, backs of the knees, wrists, ankles, and the neck. Over time, repeated scratching can cause the skin to become thickened, leathery, and darker in color, a process known as lichenification. The rash itself can appear as red, inflamed patches of dry skin. In some people, the skin may be scaly, cracked, or weeping fluid. In more severe cases, the affected areas can become infected, leading to pus, increased redness, and pain. The skin may also appear lighter or darker than the surrounding areas after a flare resolves, a condition known as post-inflammatory hypo or hyperpigmentation. Patients often report that symptoms are worse at night, which can interfere with sleep. Heat, sweat, certain fabrics like wool, soaps, and stress can all aggravate the condition. In colder weather, when the air is drier, flares can also become more common. Atopic dermatitis is diagnosed clinically, meaning your doctor will make the diagnosis based on your symptoms, history, and physical exam findings. The provider will ask about the timing and location of your rash, the intensity of your itching, your personal or family history of asthma or allergies, and whether anything seems to trigger flares. The physical exam focuses on the distribution and appearance of the rash. Certain criteria have been developed to help standardize the diagnosis. These include essential features like itching and chronic or relapsing skin inflammation, along with characteristic skin findings and a history of atopy. In some cases, additional tests might be done to rule out other conditions. Skin swabs or cultures might be ordered if a bacterial or viral infection is suspected. Allergy testing, such as skin prick tests or blood tests for IgE levels, can be considered in patients with suspected allergic triggers, although they are not necessary for the diagnosis. There are several other skin conditions that can look like atopic dermatitis, and part of the evaluation process involves ruling these out. Contact dermatitis is a common mimic. This condition is caused by direct exposure to an irritating or allergic substance, like a chemical, metal, or plant. The key difference is that contact dermatitis usually appears in a specific area of exposure and often resolves once the irritant is removed. Psoriasis is another possibility, especially in older children or adults. Psoriasis tends to cause thicker, well-demarcated plaques with silvery scales, often on the scalp, elbows, and knees. It typically does not itch as severely as atopic dermatitis. Seborrheic dermatitis, particularly in infants, can cause redness and scaling on the scalp and face. It's often less itchy and doesn't follow the typical distribution of atopic dermatitis. Scabies should also be considered, especially if there is severe itching at night and multiple family members are affected. The presence of burrows or papules in the finger webs or genital area can be clues. Infections like impetigo or fungal skin conditions can also resemble eczema. That's why it's important to get a proper evaluation if a rash doesn't improve with basic care. Managing atopic dermatitis is all about restoring the skin barrier, reducing inflammation, relieving itching, and preventing flares. Treatment typically involves a stepwise approach based on the severity of the condition. The foundation of care for all patients is regular, intensive moisturizing. Emollients should be applied at least twice a day and ideally within a few minutes after bathing to help lock in moisture. Thick creams or ointments are usually more effective than lotions, and fragrance-free products are preferred. Bathing should be limited to short, lukewarm showers or baths, and soap should be gentle and unscented. Topical corticosteroids are the mainstay of treatment during flares. These reduce inflammation and help control symptoms quickly. They come in different strengths, and your doctor will recommend an appropriate potency based on the location and severity of your eczema. It's important to use these medications as directed, as overuse, especially on thin skin like the face or groin, can cause side effects like thinning of the skin. For patients who need long-term control or want to reduce steroid use, non-steroidal anti-inflammatory creams like calcineurin inhibitors, such as tacrolimus or pimecrolimus, or PDE4 inhibitors like crisaborole, can be useful. These are often used in sensitive areas or for maintenance therapy between flares. Antihistamines can help relieve itching, especially at night, although they don't treat the underlying inflammation. Sedating antihistamines like diphenhydramine may help with sleep in some cases, but their daytime use is generally discouraged due to drowsiness. In cases where the skin becomes infected, either with bacteria like Staphylococcus aureus or with herpes simplex virus, antibiotics or antivirals may be needed. Signs of infection include increasing redness, warmth, pus, or crusting. Phototherapy or light therapy using narrowband UVB is an option for patients with moderate to severe disease who don't respond well to topical treatments. It's typically administered in a dermatologist's office a few times a week. For people with severe, widespread, or refractory disease, systemic treatments may be necessary. These include oral immunosuppressants like cyclosporin or methotrexate, or newer biologic medications like dupilumab. Dupilumab is an injectable medication that targets specific immune pathways involved in atopic dermatitis and has shown good results in reducing symptoms and improving quality of life. Lifestyle modifications are also important. Identifying and avoiding triggers such as certain fabrics, detergents, foods, or stressors can reduce flare-ups. Keeping fingernails short, using cotton gloves at night, and avoiding harsh scrubbing can help prevent skin damage from scratching. Supportive care also includes managing the psychological impact. Chronic skin conditions can take a toll on mental health, especially in children and teens. Itching and visible rashes can affect sleep, concentration, and self-esteem. Counseling or support groups may be helpful for some individuals. Atopic dermatitis tends to be chronic and relapsing, meaning it comes and goes over time. The good news is that many children outgrow it or experience significant improvement by adolescence. However, some people continue to experience flares into adulthood. With proper treatment and skincare, most people can achieve good control of their symptoms. The key is being proactive about moisturizing, recognizing early signs of a flare, and sticking with your prescribed treatments. For severe cases, newer therapies are offering more options and hope for long-term relief. If you or your child is struggling with persistent itching, rash, or dry skin that doesn't improve with over-the-counter moisturizers, it's worth speaking with your healthcare provider. If the rash is spreading, oozing, or painful, or if it's affecting your sleep, daily functioning, or emotional well-being, professional evaluation is important. Atopic dermatitis can be frustrating, but it's manageable with the right tools. Understanding the condition, being consistent with care, and working closely with your provider can lead to significant improvements in symptoms and quality of life. Thank you for watching. As always, take care of yourself and make the most of your day.